We now have the results of a database put together as a part of Obamacare. The Obama administration and the Federal Centers for Medicare and Medicaid Services have released this database, and it's showing us some really interesting information about healthcare costs around the country. So what's included in this database? The data released covers claims that were filed in the fiscal year 2011 and includes over 163,000 individual charges to patients recorded at more than 3,300 hospitals in 306 metropolitan areas. So basically, as one of the provisions under the Affordable Care Act, 100 different, the most common hospital procedures, we had an analysis of hospitals around the country and how much do these things charge, because we want to be able to compare from one hospital to another, are people being ripped off at them? We didn't previously have this information. I didn't even know that this was going to be a part of the Affordable Health Care Act, and I would not have guessed how interesting the information would end up being, but it is completely mind-blowing. So we're going to talk about a couple of, this is in New York City, by the way, we're going to be spotlighting a couple of procedures and the insane, mind-blowing, and honestly, credit-breaking difference in these charges. So first, to be put on a ventilator, which this is insanely expensive even at the low end, but the lowest cost in the New York area that came out in this database was $53,000, which is a significant amount of money. The highest cost, $115,000, more than twice as expensive for the same procedure. Moving on to one of the common reactions to a heart attack. This involves, I think they said 4 stents and something else, but it's the same procedure. Bear that in mind when we talk about these numbers. $89,000 on the low end in the New York area, $166,000 on the high end. Again, about twice as expensive at the most expensive area. Another one, this is perhaps even the most shocking, the most mind-blowing information coming out of this database. In the New York area, chronic obstructive pulmonary disease, the treatment for that, the COPD, in the Bronx, there's a place that you can get it done for $7,000. So you might think, what, is it going to be about $14,000, $15,000 on the high end? No, at the Bayonne Hospital Center, $99,000 for the treatment for COPD. So $7,000, $99,000, literally just a few miles away. We've got this map here, by the way, showing the different metropolitan areas, showing the different boroughs, and 8,000, 15,000, 7,000, 100,000, just as you go down the blocks. And this information hadn't previously been available, or if it was available in some sense, it certainly wasn't publicly available in an easy-to-use format like this database coming out from the Affordable Health Care Act. So what should we do with this information, or why is this significant? We have a problem in America when it comes to healthcare costs. I think that you know that. We spend an insane amount on our healthcare costs, far more than other industrialized Western societies around the globe. Like the quality of our care in some cases is quite good, but it does not in any way justify the insane amount of money that we're spending on it. So that's sort of like the national picture. We have this problem we have to deal with, and thankfully this database might help us work on that in some way. But I want to talk about the human cost here. Now imagine that you suffer from a heart attack, as so many Americans will at some point in their life because of our diet and our exercise habits. It's just a fact of life. A lot of people are going to have heart attacks. What does it mean for an average American family that, depending on which hospital you go to, the same exact treatment could cost $90,000 or almost $170,000? That's at least $80,000 difference just for this one thing. And by the way, when you go to a hospital, you're not paying for one procedure. I have to assume that the other different auxiliary costs at the hospital are also probably more at one rather than the other. That's more than a Corvette extra for the same exact treatment for the health problem that you have. We have credit problems in this country. People are in debt. They're spending too much money. They're already having huge problems here. Can you imagine an extra $70,000 being thrown onto the backs of an average family? $170,000 for one medical procedure? How is that family ever supposed to recover from that? That debt is going to be with them for the rest of your life. Like, think about students like me that are paying our student loan debt. $30,000, $40,000, that takes 20 or 30 years to pay off. And you're telling me that $170,000 on a guy that might very well lose his job as a result of his inability to work if he's in some sort of physically strenuous activity is supposed to pay off that amount of money? Or even more sharply, let's talk about the COPD. $7,000, maybe you go in, you get that done. It's going to be difficult for your family, obviously. That's like a whole nother credit card to have to pay off, but you can probably do it. But if you make the mistake of being taking an ambulance to the wrong hospital, or if you don't know the different options in front of you, $99,000, it's just absurd. Like, it's going to take a long time for all of the information in this database to be compiled and for us to figure out what to do with it. And I assume that long term, that's why we're getting the information. But I wanted to talk about this because I want you to think about it. When you go to the hospital, if there's any way for you to compare costs, if you can look at this database in some way, do so. Because if it's a couple of $1,000s, a couple tens of thousands of dollars, that is going to be a massive difference for your life. And this is just another way that the Affordable Health Care Act, I think, is going to help out average Americans and average American families. And I hope that the Democrats and Obama specifically get the credit they deserve, at least for this provision of the Affordable Health Care Act.